So hi everyone, myself Mrs.Madhubala. I am working as a nursing tutor in E.S College of Nursing, and this presentation is about thoracentesis. So we will see that. So thoracentesis is a procedure to remove fluid from the space between the lungs and the chest wall called pleural space. And another definition is thoracentesis is a procedure that removes an abnormal collection or accumulation of fluid or air from the chest through a needle or tube. So we will remove the fluid through needle or and tube. So this is the example of thoracentesis. So they are removing the fluid through needle. And what is the purpose means? So through this thoracentesis we can find out the abnormal accumulation of fluid in the pleural space and to relieve the shortness of breath and pain as a diagnostic or treatment procedure, to drain large amount of pleural fluid and to equalize the pressure on both sides of the thoracic cavity. So these are all the purposes for thoracentesis procedures. And what are the indications means? First one is traumatic pneumothorax. So what is meant by traumatic pneumothorax means it's a chest trauma through this the wound allows air and fluid in the pleural space. And next is pneumothorax. At the same time, the blood and air present in the pleural space, that is called pneumothorax. And another one is bronchopleural fistula. Is a sinus tract between the main stem or a segmental bronchus and the pleural space. This is bronchopleural fistula. And next one is pleural effusion. Pleural effusion is a fluid accumulation around the lungs or in the pleural space. And these are all the contraindication for the thoracentesis. And what are the contraindication means? An uncooperative patients, coagulation disorders, atelectasis, only one functioning of lung, and emphysema, and severe cough or hiccups. So these are all the reasons for contraindications. And what is the complication for this thoracentesis means? Pulmonary edema, bleeding, respiratory distress, infection, and air embolism. Dyspnea and cough, cardiac tamponade, atelectasis. These are all the complications. So we will see one by one. First one is pulmonary edema. What is pulmonary edema means? Is a excess fluid in the lungs. Second one is bleeding. Bleeding, you are all well known about bleeding. So bleeding is inside the lungs due to that procedures. And next one is respiratory distress. Respiratory distress, otherwise known as ARDS, in which fluid collects in the air sacs of the lungs and it depriving the organs of oxygen. That is respiratory distress. And next one is infections. Infections may occur due to the procedures. And another one is air embolism. Air embolism is a blockage of blood supply caused by air bubbles in a blood vessels. That is air embolism. And dyspnea and cough. You are well known about dyspnea. Dyspnea is difficulty in breathing and cough. And cardiac tamponade. What is my cardiac tamponade means? It's a compression of heart caused by fluid collecting in the sac surrounding the heart. That is cardiac tamponade. And another one is atelectasis. Atelectasis is a lung collapse. And we will see the procedure. So before the procedure, we want to explain the procedure to the patient. Not only is the procedure, we want to explain also the risk, benefits and steps of the procedures, and we want to obtain the consent from the patients for appropriate legal design. So what is the rationale for this steps means? An explanation helps to orient the patient to the procedure, assist in coping and provide an opportunity to ask the question and verbalize anxiety. Another one is we want to collect complete medical history of patient before the procedure. What are the medical history means? So any trouble in breathing, coughing and hiccups history, and had any heart disease history and smoking history, and travel to places where may have been exposed to tuberculosis. Why we are all collecting this history means to detect the any abnormalities regarding the procedures. So next is we want to prepare equipment for this procedures. What are all the things we want to prepare means dressing set, povidone or alcohol, and needle, Abraham's needle, local anesthesia like lignocaine 1%, connecting tubing or 2%, and syringe 50 ml and 5 ml syringes, formalin, scalpel blade and blade number 11, urine bottle to collecting the specimen, and needle and 3-way stopcock, sterile gloves, fenestrated towel, mask and jug. These are all the articles needed for the thoracentesis procedures. So before the procedure, and also we want to check the platelet count or presence of coagulopathy. If platelet count is less than 20,000 or there is known coagulopathy, as to whether platelet transfusion or other intervention is needed. What is the rationale for this step means to prevent the complications such as bleeding while during procedure. If we want to prevent the bleeding during procedure means, so before the procedure we want to check the platelet count to prevent the bleeding. And another one is place the patient cardiac position, that is the position for the thoracentesis procedure. So we want to place the patient in cardiac position and help patient maintain position during procedure. So what is the rationale for this step means the upright position ensures that the diaphragm is more dependent and facilitates the removal of fluid that usually localize at the base of the chest. And also we want to explain he or she will receive the local anesthetic. Why we want to explain means the patient want to know the level of the procedure, and why we are giving anesthesia means to minimize the pain during the procedure. So this is the exact position for the thoracentesis, cardiac position. That marking, black color marking is the puncture point. And we will see the procedure. So during procedure we want to observe patient respiration rate, breathing pattern. Why we want to check means to provide the baseline data to estimate the patient tolerance of procedure, because some patients we have difficulties during procedure. So in between we want to check the respiratory rate and breathing pattern of the patient, and assess patient vital signs such as blood pressure, pulse. Why we want to check means to prevent any complication such as hypovolemic shock during the procedure, and observe the patient level of consciousness and give emotional support. Why we want to give emotional support means to reduce the patient anxiety, and monitor the saturation throughout the procedure to prevent the hypoxia. And after that we want to inform the doctor if any changes of the patient after the procedure or during the procedures. Why we want to inform means to make sure whether need to continue the procedure or stop immediately. If any other complication is appear during the procedure means we want to stop immediately that procedure. And what is the after procedure care means, after the procedure we want to obtain the chest x-ray to evaluate the fluid level. Why means to compare the conditions of the lungs before and after the procedure. So through this chest x-ray we can evaluate the before and after level of the patients. So for specimen handling, fill the tube with the required amount of pleural fluid. So to prevent over intake of fluid to the specimen bottle, so we only collect appropriate level, and check that each bottle is correctly labeled by checking patient identifiers like full name, date of birth or medical record number, and this sample sent to the lab test. Why we want to send to the lab test means, so and we want to know what is the causative organism is there in the sample, and also why we want to do this step means to prevent from incorrect result to the patients. That's why we want to correct appropriately. And a patient want to rest in bed for about 2 hours after the procedures. Why? Means to minimize the patient activity due to the complications such as dyspnea. And blood pressure and breathing will be checked for up to a few hours, because after procedure we want to check blood pressure. If some patient will go for hypotension and some patient will go for hypertension. That's why we want to check the blood pressure and breathing after the procedure after few hours. And why want to check the blood pressure? Means to make sure don't have any further complications, and may remove the dressing bandages another day. So you don't remove on that day, or replace it if it becomes soiled or wet. Why we want to do this? Means to prevent from getting infections. So we won't remove dressing on that day. We want to remove the dressing another day. And resume patient regular diet. Why we want to concentrating diet? Means diet only help for the wound healing. To promote the wound healing, we want to give regular diet to the patients. So thank you for watching.